Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer. Fertility expert Dr. Amy Abazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Welcome to the Egg Whisperer Show. I'm so excited, you guys, to have Dr. Kate White on today's show. Welcome, Dr. Kate. Thank you for being here.
Thank you for having me. It was a real pleasure.
Well, we're going to talk about your book, and the title of today's show is Hope and Healing After Pregnancy Loss. But before we get started, I want to talk to our listeners and tell them about you. You're a practicing gynecologist and the vice chair of academics and the director of fellowship in complex family planning at Boston Medical Center and associate professor of OBGYN at the Boston University School of Medicine. And we're here to talk about your book, Your Guide to Miscarriage and Pregnancy Loss. Hope and healing when you're no longer expecting. You teach women how to better understand their bodies. You help women be unafraid of seeing the doctor, and you arm them with the right questions to ask. Dr. Kate gives people the information they need to make the best choices for themselves and their lives. And I'm just so honored and just feel so lucky that you gave us the time today to talk to us about your passion. Thank you.
This book was such a labor of love. I could talk about it all day long to anyone who wants to listen. So I'm so happy to be here.
So I love hearing about doctors and obviously there's a particular thing I like to hear about is how you made your way into this specialty. What drew you into this field?
I think I was like a lot of medical students in that I really liked everything that I rotated through in the year where you're sort of trying to decide what to do. But I think it came down to two things. The first was that in OBGYN, you get to have these long-term relationships with patients and you get to fix problems. So I think by nature, I'm a sort of a problem solver. I like to fix things in addition to having, time with a person over the course of their lives. The second was how much I enjoy teaching patients. And I found that in a lot of the primary care specialties, you're telling patients things they don't want to hear. Stop smoking, lose weight, exercise, watch your cholesterol, watch your blood pressure. But in OBGYN, it's here's why your discharge is normal. Here's why your body is actually normal. Here's what all the changes mean during pregnancy. And that relationship with patients where they really wanted to hear all the things I had to teach made it feel more like a partnership than sort of this hierarchical relationship. And so that's what sealed the deal in the end for me.
And there's so much about what you do that holds a special place in my heart. But my father actually was an OBGYN and he did his residency at BU. And that's where I was born, my sister as well. So, yeah. And then I went into this field because of the miscarriages my mom had. So thank you for writing this book for all those women who have suffered the way that she suffered. And hopefully your book will help them suffer even less. So the title again is Your Guide to Miscarriage and Pregnancy Loss, Hope and Healing When You're No Longer Expecting, because it lovingly addresses miscarriage and the healing that takes place after having experienced one. It's, medical approach to miscarriage care with a compassionate exploration of the physical and emotional aftermath of pregnancy loss. So what drew you to write this book?
I think it was a combination of two things. The first was I wrote the book that I wanted to have when I went through my pregnancy losses. I had a really traumatic stillbirth at 29 weeks and a more typical first trimester loss around 6 weeks. And even though you think, well, I'm a doctor, I should know everything, I certainly knew the medicine. I was not prepared, though, for the journey of recovery that followed miscarriage. And I felt pathless and directionless. And for a person who is a type A personality, who is always in control of everything, it was a really scary time. So I like the idea of sort of giving people a roadmap to what was going to happen before, during, and after their losses. And the second is that I wrote the book that I want my patients to have. I think we never get enough time with people in the office, especially when we're talking about big, important things. Visits always have to end too quickly. So this book sort of continues the conversation that I have a chance to start in the office. And I want patients to take a piece of me home with them. And by writing a book, then it's not just a pamphlet in my office. All patients get to hear how I talk to my patients about loss.
Yeah, I feel like there should be a miscarriage help desk. And your book will be just handed out at that help desk. There are millions of miscarriages every single year. I think even in this country alone.
There's a Butterball turkey hotline for people at Thanksgiving when they're cooking their dinner, right? How do we not have like on-demand access from experts for miscarriage care?
No, literally. I mean, I dream of things like that. Like, how can we do things? And we should talk and make that happen. I'm going to add that quote and make sure that people tune into this show, because you're right. This could be our version of the Butterball helpline. So you divided your book into 3 different sections, and I think that they're like the organization is like perfect. So preparing, experiencing, and healing. And obviously I don't want to give away everything that's in the book. I want people to actually get a copy and, have it for when they really need it. But can you just walk us through the preparing part?
The first is around getting the diagnosis, which you might think would be really clear, right? You're pregnant or you're not. You have a healthy pregnancy or you don't. But as all OBGYNs and OB care providers know, it is not always that simple. And you can actually have doubt for weeks based on how your ultrasound looks, based on the results of your blood tests. So there's also a lot of waiting. So I talk about why you can't get the diagnosis right away and what it means for it to take this long. Then there's also understanding what it means when someone says that you have a loss. Is it a regular first trimester loss where it was a pregnancy in the uterus that stopped growing? Do you have one of the odder losses that I talk about that aren't as common and get no airtime, like a pregnancy in your tube or a molar pregnancy? Because there are other kinds of losses in addition to sort of the standard first trimester miscarriage. And then I talk about what to do while you're waiting, because even though a lot of people really wish that a provider could snap their fingers and the pregnancy was over, it is never that simple. And so you can do a lot of things to prepare yourself before the miscarriage eventually happens.
That's true. And that goes into experiencing the loss. So how should someone think about that part?
So if you are like most people undergoing a first trimester loss, it's the first trimester. And once you have certainty about the diagnosis, very often you have a choice, which does surprise some people. At a time that you are feeling totally powerless, you actually have a little bit of choice about how to manage your miscarriage. And then as you choose which way to go, whether it's waiting it out for your body to pass the pregnancy on its own, choosing a surgical procedure, a D&C, or something in the middle, which is medication management, the living through it feels really different. So I talk in really great detail, much more than you can get from an internet search, about what it is like to sort of experience these 3 things. And I do talk about all these other kinds of special circumstances. If you don't have a typical loss and no one knows what to say to you and your friends have no idea what you're going through, I take you through all of those processes too.
Yeah. And when does a loss get labeled as recurrent? What does that mean?
So the textbook definition from when you and I were both in medical school is when a person has had 3 or more first trimester losses. That is the classic definition. But a lot of us would recommend that people begin a workup if they want to try to know what's happening and what might be causing it, even after 2 losses, especially if you're in your mid-30s or beyond. I would never make a patient wait for a 3rd loss before I would start doing some testing.
Right. And healing is your last section. And I'm sure there are a lot of people out there that can relate to some of the, I'll call them snarky comments that well-intentioned people try to make to help you heal. But from your perspective, what is the best way for someone to actually go through that healing process?
The first thing I tell my patients, whether it's in my office or in this book, is I want to validate this grief. It doesn't matter if you were 6 days, 6 weeks, 6 months pregnant. It doesn't matter. When you lose a pregnancy, you are losing all of the hopes and dreams that went with that pregnancy. You are picturing giving birth to a baby, about what your family is going to look like, what your Christmas card picture may look like. You're probably picturing first steps, first smiles, and possibly even graduating from high school. And so you lose all of that in one fell swoop. So the first thing is that don't let anyone tell you, oh, well, you were early, or you could just try again. It doesn't matter. You wanted to be pregnant now, at this point in time, with this pregnancy. So the grief is real. And so the first thing is to do is just give yourself space for that. Next, it is take care of yourself in those first days and weeks after the loss, whatever that looks like. Hopefully you work for an employer who will give you some leave. Miscarriage leave absolutely should be universal, but right now it's kind of dependent on who your employer is. So if it's time away, if it's turning down other obligations, if it's not decorating for the holidays this time of year, or heaven knows, not going to someone else's baby shower because you don't want to, do whatever it takes for you to sort of just be able to breathe in those first days and weeks. And then after that, it's looking for ways to remember the pregnancy if you want to. And that looks different for everyone. My husband and I have planted a tree in every house we've lived in since we lost our daughter at 29 weeks of pregnancy. So it's Samantha's tree. It's always the one that grows the best in our backyards. I have no idea why. Maybe we give it a little bit more TLC. I don't know. But other people do other kinds of rituals or ceremonies, whatever feels right to you about recognizing that pregnancy, which will always be a part of you even as time goes on.
And you brought up having a partner, and for you, it was your husband, and it sounds like you guys were on the same page, but not everyone has that supportive partner. Do you have advice as to how someone can communicate with that person if they're not necessarily understanding why you're hurting and grieving so much?
I love my partner. I got really lucky. I feel like I married a good one. Hopefully, it will be my only marriage for life. We were not on the same page. And it came down to the fact that because with my first loss, I almost lost my life, he was really grateful to keep me. I felt no such gratitude. I was not that happy. I just could not believe that I woke up from this trauma without my baby. And so we were in very different places from the beginning. And as time went on, he wanted to try to move on. Oh, I hate that expression. And I wanted to talk about it and think about it and ruminate a bit more. And so we were very much not in the same place. Years later, we got some couples therapy, which I think would have helped us if we had gotten that at 4 or 6 months after the loss. So I cannot say enough positive things about people who are really in different places. But if you can't afford it, don't want to at the time, can't drag your partner there, I think what you need to do is both talk about where you are and figure out how to meet in the middle, which sometimes is putting like a time limit on a conversation, meaning we're going to talk for 10 minutes. I'm going to tell you everything I'm feeling, and then we're going to stop, which gets across my need to purge to you all the things I'm feeling right now. And he knows it's not going to last forever. So in trying to find a way forward for both of you, for us, a little professional help was helpful, but otherwise just good open communication and meeting in the middle.
Yeah, I think you're right. I mean, professional help as soon as possible and taking care of yourself. I feel like one of the first things when I share with someone that the pregnancy has stopped growing, they say, well, now I'm going to go eat a whole bunch of stuff that I shouldn't be eating and drink way more alcohol than I should be. And then, that might make us feel good in that moment. But I think, I want people to nourish themselves with healthy food and continue to be active and get the help that they need at the time of diagnosis. So then there's also this whole, messaging and mixed messaging about when you can try and get pregnant again. And I get frustrated because sometimes I have patients that have come to me and their doctor told them, oh, you need to wait a year to let your uterus heal. And that just drives me bonkers. And I can see it drives you bonkers too. So how does someone know they're ready to try to get pregnant again?
So I will start with the caveat that there are some kinds of rare pregnancy loss where you do need to wait. If you had a stillbirth that required a C-section, for instance, to deliver your baby, it is likely that you need a chance for your uterus to heal before you want to get pregnant again. If you had an ectopic pregnancy, like a tubal pregnancy, and you had to take methotrexate, which is a really powerful medication to dissolve that pregnancy, we don't know what the effects of methotrexate are if they're lingering when you get pregnant again. So often the advice is to wait 3 to 6 months. So there are these really specific situations in which you should wait. For everybody else, you do not need to wait at all. Your body, though, might be ready faster than your heart is. So I tell people from the medical perspective, you often can start trying as soon as you want to. Your body, as after a pregnancy is over, is really ready. Your ovulation returns quickly and you are ready to get pregnant again. But your heart may not be, and that's okay. So if you want to wait for healing, for the time to be right, that's perfectly okay. But don't let any doctor tell you that you have to wait 3, 6, 12 months, because it just isn't true.
I agree. Well, thank you, Dr. Kate, for all of the hard work you put into this phenomenal book. I'm going to make sure to let all my patients know about it from the time of a diagnosis so that they can feel less alone. So is there anything else you want to share with our listeners today?
I would say that because miscarriage is more common than most people realize, everyone knows someone who's gone through pregnancy loss, and you usually don't know that until you start sharing your story. And I would never want someone to go past their comfort zone to talk about something really personal and painful. But the more people talk about it and the more you sort of can tap into that community of people around you, you realize that a lot of people have walked this road before you, and you can find support and strength in places you never knew if you can be open enough to talk about it. So the community of people is out there who have experienced loss. And even though you never wanted to join that community, it welcomes you with open arms.
That's so true. So can you tell us again, where can people find you to get, to learn from you and to buy your book?
So you can visit me at my website, drkatewhite.com, and my book is available everywhere. So for the fastest, online experience, it can be up to your house in 2 days from all the major retailers online, but you can also get it at independent bookstores or bookstore chains near you.
Wonderful. Well, thank you again for everything that you're doing, and say hi to all my friends at BU. My residency director, Dr. Jody Abbott, I think she's still there. Yeah. Please give her my love. I'm a huge fan of you and her and all the work that you guys do there. So thank you again for continuing to do things to make our lives better as women, especially when it comes to the support we get when we miscarry. Thank you, Dr. Kate.
Thank you so much.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer. Fertility expert Dr. Amy Abazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.